يلا.
Good afternoon, everyone. It's a pleasure to meet you. I am Rabi' Radwan, a third-year medical student at An-Najah National University. Today, I'm excited to share insights about the health concerns that affect communities worldwide, which is diabetes mellitus. The aim of this presentation is to shed light on the diabetes mellitus and its impact on our society. To guide this exploration, I've organized my presentation into four interrelated sections. Firstly, definition of the diabetes mellitus, and the second section, causes and types. Third, symptoms, diagnosis, and treatment prevention, and finally the conclusion. I appreciate your time for presence here today. Don't worry, it don't last more than 5 to 7 minutes. I use this slide presentation and some pictures to facilitating the understanding. Okay, let's dive with the presentation. Definition. Firstly, the diabetes mellitus is not a single disease. The diabetes mellitus is a group of diseases. All of these diseases affect the body, how the body uses the blood sugar, which is a glucose. The body cells, all cells of the body, uses the glucose by the insulin. When insulin binding to the receptor on the surface of the cell, this allow to glucose to enter to cells and cells to utilize it. So the defect in diabetes mellitus, in all type of diabetes mellitus, is insulin. This is a physiology. Normal blood glucose 4 to 5.4 millimole per liter, or in milligram per deciliter 72 to 99. Okay, types and causes. There are three types of diabetes. Type 1 diabetes, type 2, and gestational. Type 1 diabetes account 10% of all cases of diabetes. Type 1 diabetes mellitus, we called it a juvenile diabetes mellitus or a diabetes of children because it's occur mostly in the children. The mechanism of this disease is an autoimmune disease, which is antibody that against the islet of Langerhans of the pancreas, which destruct it, and this don't allow the pancreas to produce and secretes the insulin normally. Type 2 diabetes, we have insufficient amount of insulin, but this insulin is insensitive. The cells are desensitized for this insulin. That is what we call it insulin resistance. And this type of diabetes, type 2 diabetes, account 77% of all cases of diabetes. The greatest percent of all diabetes. Gestational diabetes mellitus, from its name, gestational, occur during the pregnancy, and it's temporary. Once the delivery has occurred, the diabetes will disappear. Symptoms and diagnosis of diabetes. The symptoms of diagnosis are obvious. Firstly, increase the thirst, increase the water intake, which we call it polydipsia, slow healing cuts and sores because the inflammation and the immune system will be weakly, fatigue, tiredness, blurred vision, frequent urination, which is a polyuria, polyuria in frequency, not in volume, called it a frequent urination, and unexplained weight loss. The unexplained weight loss don't occur in the gestational diabetes mellitus because it's a temporary and the time will not permit. The diagnosis of diabetes mellitus, it's a laboratory. We have two tests like OGTT, which mean oral glucose tolerance test, and fasting blood glucose. This is a laboratory technique for diagnosis. Treatment and prevention. Blood glucose monitoring. The first thing for treatment and even prevention is a blood glucose monitoring. We called the defect in the insulin. So the therapy will be insulin therapy and some medications that affect the insulin and how the cells response to insulin. Lifestyle change also it's important in treatment and prevention. Balanced diet and a kind of diet that that composed of more vegetables, fruits, and less sugar, carbohydrates, regular exercise, be active, don't be sedentary, and maintaining healthy lifestyle are crucial for prevention and treatment of diabetes. Like this diagram, eat more fiber-containing food, don't drink alcohol, drink more water, don't be sedentary, smoking, don't smoke, exercise, junk food, don't eat junk food. Okay, finally, in the conclusion, as we see the diabetes mellitus, it is problems worldwide. Diabetes mellitus, significant contributor of mortality and even morbidity worldwide. Controlling your blood sugar, glucose, and blood fats, it will significantly lower chance to meet this problem, which is diabetes. About me, I recommended everyone who are over age 40 to making this two tests, this screening test, because he is asymptomatic. Even he is asymptomatic to perform these two tests every 3 years if it's normal. Fasting blood glucose and hemoglobin A1C every 3 years to everyone who are over the age 40. And this is the reference. And thanks.